You've done your research. You know you want a dental implant. You've seen the befores and afters, you've heard the pitch, and now the question isn't whether you want it or not. It's, what's this going to look like? How long is it going to take? What are the steps? Who does what? And is there anything I should have done differently before I got here? These are exactly the right questions. And if no one's walked you through the full picture, from the first consultation to the moment the crown is seated and you're walking out of the office, that's what we're going to do today. No glossing over the timeline, no minimizing what's involved. Just the complete, honest process. Let's get into it. What's up everyone, Dr. Eric Jackson here, hope you're doing well. I've been practicing dentistry here in Downers Grove for nearly 20 years, and today we're going to do a deep dive on dental implants. What they are, how they work, what the full process looks like from start to finish, and why the decisions made before the implant can be just as important as the implant itself. If you've been watching this series, I'll link prior videos below, by the way. We've already covered a lot of ground. We've talked about what happens biologically when a tooth goes missing and nothing is done. Bone loss, shifting teeth, bite breakdown. And in the bone graft video, we covered why socket preservation at the moment of extraction is the smartest first move you can make, because preserving bone is dramatically simpler than rebuilding it. Dental implants are where that preparation pays off. The bone you preserved, or the bone we grafted, is the foundation this whole thing is built on. Let me start with what a dental implant actually is, because there's a surprisingly common misconception worth clearing up right from the jump. A dental implant is not just a false tooth, it's a root replacement. And that distinction matters more than most patients realize. A natural tooth has two parts: the crown, the part you can see above the gum line, and the root, the part embedded in your jawbone below the surface. When a tooth is extracted, you lose both. A dental bridge replaces the crown, the visible part, but it doesn't replace the root, which means the bone underneath has nothing to maintain it, nothing stimulating it, nothing signaling to the body that it's still needed. And as we covered in the tooth loss video, that bone starts to disappear. A dental implant replaces the root. Here's what the system looks like. 3 components working together. The implant body, a titanium post, roughly the size of a natural tooth root, that's surgically placed directly into the jawbone. The abutment, a connector piece that sits on top of the implant and extends through the gum line. And the crown, the tooth-colored restoration that attaches to the abutment and is what you actually see, bite with, and use every day. The magic's in that first piece, the titanium post in the bone. That's what makes implants fundamentally different from every other tooth replacement option on the market. Titanium has a unique biological relationship with bone. Most foreign materials that the body encounters, it rejects or walls off. Titanium, though, processed correctly with the right surface texture, it does something different. The bone actually grows into and around it. The implant and the jawbone become, over time, essentially one structure. This process has a clinical name: osseointegration. Think about the difference between a post hole and an anchor bolt. You can pull a post out of a post hole with enough force. An anchor bolt, though, once it's fully set, torqued down, and cured, is part of the structure. You're not pulling it out. Osseointegration turns the implant into that anchor bolt. This is not a quick process. It takes time. Typically 3 to 6 months, sometimes longer depending on bone density, overall health, and whether bone grafting was part of the picture. During that healing window, we ask patients to protect the site. No unusual loading forces, proper oral hygiene, attending follow-up appointments, so we can monitor the process. But at the end of that healing period, what we have is an implant that is extraordinarily stable, functionally integrated with your own biology. And that implant is then ready to support a crown that's, in our clinical experience, about as close to a natural tooth as modern dentistry can provide. Let me walk you through the full process from start to finish, because I think understanding the steps removes a lot of the anxiety. Step 1 is the consultation and imaging. This is where everything starts. A thorough implant consultation is not just a conversation. It involves imaging, specifically a cone beam CT scan, which gives us a 3-dimensional picture of the jaw, the bone volume, the bone density, the positions of the nerves and sinuses, and any anatomical factors we need to account for. This is the map we use to plan exactly where the implant goes, what angle it's placed at, and whether any pre-implant bone work is needed. I've got a cone beam CT right here in the office, which is actually not that common amongst general dentists, and I'm quite proud of the fact. It gives us a level of precision that traditional flat x-rays simply can't provide. Step 2 is the surgical phase. This is where the implant is physically placed into the jawbone. Depending on the clinical situation, this may be performed by a periodontist or an oral surgeon. At Jackson Family Dentistry, we work closely with trusted specialists. And for patients who are certain from the start that they want an implant, having a specialist control the full surgical phase, from extraction through implant placement, is often the cleanest and most efficient path. Step 3 is the osseointegration window, the healing period we described moments ago. 3 to 6 months, the implant is quietly integrating with the bone. There's typically a temporary restoration in place, so you're not walking around with a visible gap. You're living normally. You're eating. Healing is happening below the surface. Step 4 is the restorative phase. Once osseointegration is confirmed, we then design and seat the final crown. Digital scans, traditional impressions, shade matching to your adjacent teeth. A final restoration that's custom built for your specific anatomy. This is the appointment that most patients have been waiting for. And when it's done right, from the outside the result is, in most cases, remarkably close to a natural tooth. Total timeline from first consultation to final crown, typically about 3 to 12 months. If bone grafting or ridge reconstruction was needed before the implant can be placed, build in some additional time. Bone work has its own healing window before the surgical phase can begin. In ideal cases, timelines can be shorter. The point is, there's a clear, manageable sequence of steps, and each one has a purpose. Here's how I want you to think about the experience in our practice. Your treatment is coordinated from start to finish. The cone beam imaging, the treatment planning, the specialist coordination when the surgical phase calls for it, and the final restoration, the crown that you're going to live with for the long term. The reason this matters is continuity of care. The worst version of the implant experience is when a patient bounces between multiple offices that never actually talk to each other. The plan frays, expectations get misaligned, nobody's holding the full picture. What we offer is a coordinated process where all those pieces are managed together, even when the surgical phase involves a specialist. You're not navigating this alone. That's a genuine advantage, and it's something we're very fortunate to be able to offer. Let's talk about candidacy, because I want to address a misconception that stops a lot of patients from having even the initial conversation. The misconception is that implants are only for certain patients, that a lot of patients don't qualify. In reality, the vast majority of patients who need to replace a missing tooth are implant candidates, with appropriate planning. What we're primarily evaluating is bone. Is there enough volume? Is the density adequate? Are there anatomical factors that require additional planning? This is exactly why a cone beam CT is so valuable at the front end. It tells us precisely what we're working with before any surgical commitment is made. If the bone volume is insufficient, which, as we've discussed, happens when your tooth has been missing for a while without grafting, that doesn't automatically disqualify you. It means we address the bone first. Perhaps a ridge augmentation, maybe a sinus lift if it's an upper back molar. And then, once the bone's matured, the implant can be placed. Longer road, same destination. Overall health is part of the picture as well. Diabetes, certain medications, smoking, these can affect healing and need to be part of the planning conversation. But none of them are automatic disqualifiers. They are factors that inform how we approach your case. Bottom line, if you're wondering whether you're a candidate, the answer is probably yes, with the right workup and the right plan. The consultation is where we find out what we're dealing with and map out the plan forward. I want to close the clinical content with something I haven't said explicitly yet, and it connects back to everything we've covered in this series. A dental implant is the only replacement option that replaces the root, and replacing the root is the only thing that stimulates the bone to maintain itself. A bridge sits over the gap. The bone beneath the false tooth still resorbs. A partial denture covers the ridge. The bone still resorbs. An implant, though, it drives a post into the bone and sends a signal. Hey, this area is still in use. Keep the bone here. This is the long-term biological argument for implants that doesn't get made nearly enough. It's not just a cosmetic restoration. It's a bone-maintaining restoration. And that distinction matters for the health of your jaw, the stability of your adjacent teeth, and the longevity of your entire dental arch decades from now. Here's what I want you to take away. A dental implant is a titanium root replacement that integrates with your own biology and supports a restoration designed to closely replicate the look and function of the natural tooth. The process takes time, typically 3 to 12 months from first consultation to final crown, and potentially longer if bone work was part of the picture. But the steps are clear, the outcomes are excellent, and for most patients, it's the most complete solution available for a missing tooth. The bone you preserved, or the bone we grafted, it's ready for this. That's the payoff for making the smart move early. And if you're starting fresh without any of that groundwork, it's okay too. We'll figure out where you are and we'll build a plan from there. If you've been sitting on this decision, whether it's because of the timeline, the cost, the unknown, or simply because nobody ever walked you through it clearly, I hope this video has changed that. Come on in, let's get the imaging done. Let's see what we're working with and put together a plan that makes sense for your situation, your timeline, and your budget. And the next video in this series is one I strongly encourage you to watch, even if you already have an implant, because maintaining it is a totally different conversation than placing it. And most patients don't find that out until something starts going wrong. That video is coming next. Find us at Jackson Family Dentistry, 2033 Ogden Avenue, right here in Downers Grove, Illinois. Give us a call at 630-963-6750 or visit us online at jacksonfamilydentistry.us. New patients are always welcome and we'd love to take care of you. If this video was helpful, give it a thumbs up and hit subscribe. I put out content like this regularly and I'd love to see you in the next one. I'm extremely passionate about modern dentistry and love discussing it with patients. Drop your questions in the comment section below and I'll do my best to get back to them quickly. Thanks for watching. I'll see you in the next video. Take care of yourselves now. Bye.